What surgery would be performed for upper eyelid bilateral ptosis of the right eye? I have been told by several doctors on here following a picture I posted, saying I have upper eyelid ptosis of right eye and also that it's bilateral. My question is, what surgery would be performed for this? What are the outcomes? I don't want to rush into anything too hasty, especially concerning important parts like my eyes. Thanks.
Thank you for your question. You've submitted a photo and you write in your question that you have ptosis of the right eye, and doctors have also told you have ptosis in both eyes. You want to know what's involved with the surgery and that you don't want to make a hasty decision. Well, certainly you have made a good decision by first analyzing whether or not this is the right choice for you to pursue. Whenever I see a patient with ptosis, my first question is, of course, how long has that ptosis been like that? Have they noticed? Is this something new? Is this something that's been happening over time? Essentially, a thorough history is critically important. If it has been mentioned to you, I should say, that you have ptosis and it was an incidental statement that you were never aware of, then it's meaningful because it may mean that you were never really bothered by it. Ptosis in and of itself is not a reason to do surgery unless you are concerned about the aesthetic appearance or if there is also a functional issue related to vision. In order to do a proper ptosis examination and to evaluate whether you need one eye or both eyes done, you ultimately would need a proper ptosis evaluation. What I mean by that is the eyelid muscle, called the levator muscle, is a very sensitive muscle, and there are certain things about that muscle that makes it even more complicated to deal with. This is why 99.9% of board-certified plastic surgeons don't do this type of surgery, and that this is the domain of the oculofacial plastic surgeon. That being said, one of the things that is tricky about ptosis and why you're probably getting some confusion about whether it's one eye or both eyes is that there is a particular physiological law called Herring's law that has to do with the amount of tone each eyelid receives as a function of that muscle, what's called the muscle innervation, or the amount of tension that that muscle has. So it's been seen that if you lift one eyelid, in certain cases the other eyelid will actually come down. And so then that's why during ptosis surgery, in the preoperative photos, a person can look like one eye is low and the other eye is high. And then if you just do one side, then the first side can be high and normal, and the other side can be low. So again, I can't stress enough the importance of a proper examination. But most importantly, you have to decide if you're bothered by the ptosis at all. Within the normal population, 1 to 2 millimeters difference between the eyes is usually acceptable as normal, and most people don't notice that. When people notice ptosis has to do very often with when other people tell them that do you have a lazy eye? Which of course it's not a correct term, but still that's how patients have described it to me. Or is there something going on with one eye? Why is that one eye closing? So it sometimes takes several visits for me to make a decision before I decide to move forward with a ptosis operations. When a person comes in with a relatively subtle amount of ptosis, I want to look at them at different parts of the day. Maybe at the end of the day they're more fatigued and the ptosis is more prominent. So I think that your task now is to meet with qualified, experienced oculofacial plastic surgeons who can guide you, and you can get some opinions and look at their work and get a sense of what the threshold is that would be right for you, if this is even right for you at all. Again, you've submitted one photo, and it's clear that there's a slight difference between the two eyes, but to me, from that photo, it's only slight. So move forward and meet with doctors, get some opinions, and understand the risks, benefits, and options of doing this procedure, and then take it from there. So I wish you the best of luck. I hope that was helpful, and thank you for your question.